Happy Friday and welcome. Thank you for joining us. My name is Matthew Vino. I'm Executive Director of the Group Insurance Commission. This is the final of 3 annual enrollment information sessions for active employees that we are holding this year. We also hosted sessions for retirees within the last 2 weeks. And all of these sessions are conducted virtually, as you can see, by Zoom. And we will post the slides that we use today and videos of the sessions on our website at mass.gov/GIC. We are holding these sessions, these special sessions this year because we have a wider range of changes than in a typical year for reasons that I will address in this presentation. You can also find the GIC benefit guides on our website at mass.gov/GIC. So please log on to view those. This presentation is intended to give a high-level overview, but there is much more detail in the guides than we will be able to go over here today. For the hearing impaired, we are providing CART services and ASL interpreters, and you can find more information about that in the link in the chat. Our plan this afternoon is to do a 35 to 40-minute presentation followed by a Q&A session. So let's get started. Here is our agenda for this afternoon. I will start with a few brief comments about why we're here today. Then I'll jump right into details about changes to the health insurance options for active employees and dependents to help you get ready for annual enrollment. Then we will address changes to how we provide prescription drug coverage and flexible spending accounts. We will touch on briefly some other benefits that are not changing, dental and vision benefits, and our employee assistance program. And we will conclude with quick tips and on how you can prepare for annual enrollment before we move on to addressing questions during the session. Speaking of questions, you may submit those at any time during the presentation using the Q&A function of Zoom, which is typically located at the bottom of your Zoom screen. We will be reviewing questions real time and responding to them, as many of them as we can in writing, also right in the Q&A tab of Zoom. With such a large number of participants, about 1,000 at this moment, we may not be able to get to every question. But when we finish the presentation, we will verbally respond to questions that we sense may be of general interest to everyone attending. I also want to note, for those who may wish to make a more lengthy statement, I encourage you to send us written comments at gic.info@mass.gov rather than typing that into the Q&A. And finally, if you have a specific question about your coverage, your specific coverage, including personal details, please contact us directly using the phone number and the web link for our online contact form listed here on the slide. We want to make sure that we preserve your privacy, so please do not share personal information in the Q&A function of Zoom. At the bottom of the slide, just a note that if we have any GIC coordinators who have joined us, we are sending you training materials and you should be receiving those very soon. So why are we hosting this session today? As I mentioned earlier, this is an unusual year, and I want to say a few words about why. First, I always want to start with our mission, which I hope you are familiar with. And on the left, And to meet this mission, as you know, we provide a full suite of insurance benefits. More specifically, we're here today because our annual enrollment period is less than a week away. It will launch next Wednesday, April 5th, and end on Monday, May 3rd. This is the time when anyone eligible for GIC coverage can make changes to their insurance choices for coverage that will start this coming July 1st. We want to make it as easy as possible for you to interact with the GIC, so we have recently launched an online member portal called MyGICLink, which is now available to all of you as long as you have a valid email address. You're not required to use the portal, as we will continue to accept paper forms and assist you by phone. But in the portal, you'll be able to do just about everything online with the GIC. You can be the first to get timely updates from us, important information. You can review your current benefits and update your information. You can add or change beneficiaries. And during annual enrollment, you'll be able to compare different options for health insurance that you're eligible for and actually complete your enrollment. So I encourage all of you to visit the GIC's website to learn more about MyGICLink, including how to register and how you can use this new tool. So as I said, there are a number of changes to benefits this year, and I want to say a few words about why. First of all, the GIC is required to contract at least every 5 years with the companies that we work with to provide you benefits. And that makes it an opportunity for us to make sure we're working with the best companies to accomplish our mission and really to keep those companies on their toes. Second, as everyone can well appreciate, the healthcare system is constantly evolving and changing. So our strategies also need to change to keep up so that we can continue to accomplish our mission. So for example, one big change that you're likely aware of is the merger of two of our longstanding health insurance plans, Harvard Pilgrim and Tufts Health Plan. Also, you may know that Always Health Partners has changed its name to Mass General Brigham Health Plan. At the same time, hospitals and doctors' offices are also merging, sometimes into ever larger systems. And there is a lot of research and data that shows this is one of the main reasons that insurance premiums are rising. And new drugs continue to be invented, sometimes ones that are dramatic new cures for disease, which we should all celebrate, but they also come at an enormous cost and continue to drive up our premiums. So to deal with these changes, we have to adjust our strategies from time to time and our insurance plans, and that means making some changes. Finally, on the right, when we do recontract with our health insurance plans, it's a good and logical time for us to also make adjustments to features of each individual plan, including co-payments and deductibles. So you put all of this together, and it makes this a year of more change than we typically see in an ordinary year. All right, so let's jump into what's changing and what's not changing for those of you who are eligible for active employee health insurance. At a high level, starting on July 1st, these are the companies that the GIC will be working with to provide you coverage, organized by plan category. I'll speak to the changes that are implicit here in the next set of slides. But high level, first, in the national category, we do have a new plan offered by Harvard Pilgrim. this will be a plan only for GIC members who live outside of New England. For those of you who live in New England, on the upper right side, you can see that we continue to offer a choice of broad network plans by Harvard Pilgrim, Unicare, and Mass General Brigham. On the lower right, Harvard Pilgrim and Unicare will continue to offer limited network plans. And in the regional plan category, Health New England will continue to be available to our members who live in Western Massachusetts. As you can tell from the prior slide, many important elements of our health insurance offerings are not changing, and I want to highlight those first. We will continue to offer a variety of choices and work with many of the same insurance companies, though there are some changes to specific plans, which I will get into in more detail. But we do continue to offer several different types of plans, HMOs or health maintenance organizations, which feature a closed network of hospitals and doctors, and a primary care physician who is managing your care. We continue to offer POS or point of service plans, which are similar to HMOs, but with broader access to hospitals and doctors outside of that closed network. And indemnity plans, which give the broadest access to nearly all providers. We will also continue to offer both broad network plans that offer wide access to providers across the state, but also limited network plans for those willing to give up a little bit on the access to the most expensive doctors and hospitals in exchange for a lower premium. Secondly, here while we are making some changes to co-payments that I'll talk about in a moment, we are not implementing broad cost shifting to our members through higher co-pays and deductibles. And I want to note that our out-of-pocket maximums are not changing. They will not increase in any plan. And finally, we are making no changes to dental, vision, or life insurance plans this year. Also, we are making no changes to the Health New England plan that is available, as I said, to residents of Western Massachusetts and those just over the border in Connecticut. That plan will continue as it is today. So while a lot is staying the same, there are a number of changes to active employee plans that you will need to consider as you make decisions during annual enrollment. I'll say a little more detail about each of these in the next several slides. But high level, first, with the merger of Tufts and Harvard Pilgrim, Tufts will no longer be offering active employee insurance, health insurance plans. That includes both Tufts Navigator and Tufts Spirit. Second, depending on where you live, some of your options will be different in the coming year, those plans that you're eligible for. Third, as I noted earlier, you will see targeted changes to co-payments in a few plans. And finally, the names of some specific health insurance offerings will be different. Again, I'll talk through each of these in turn, starting with the Tufts health plan changes. As I've mentioned, Harvard Pilgrim and Tufts recently merged into one company called Point32 Health. And as a result of that merger, not any decision made by the GIC, Tufts will no longer be offering Tufts Navigator. So if you're enrolled in Tufts Navigator today, please know that you will continue to be covered under that plan through the end of June. But during annual enrollment, you will have to select a new plan, or the GIC will make the decision for you and put you in a similar plan offered by Harvard Pilgrim called Explorer. The good news is that you have lots of other options depending on where you live. Harvard Pilgrim, Mass General Brigham, and Unicare will continue to offer broad network health plans. Also, for those looking to save a little on premium, you may consider the limited network plans offered by Harvard Pilgrim and Unicare. And you also have the option of Unicare Total Choice, another broad network plan. So for us at the GIC, it's very important that no one goes without coverage. So as I noted, if you're enrolled in Tufts Navigator today and you do not actively choose a plan during annual enrollment, we will default enroll you in Harvard Pilgrim Explorer. This is the most similar plan that the GIC offers, but please be aware that the premium for this plan will be significantly higher than it is under Navigator today. So it is especially important this year to make sure you actively shop among your options. Next, we move on to Tufts Spirit. As with Navigator, Tufts will no longer offer this active employee plan for the coming year due to the merger with Harvard Pilgrim. Again, if you are in Tufts Spirit today, you will continue to be covered under that plan through the end of June. But during annual enrollment, you will have to select a new plan, or we will default enroll you in the most similar plan that you are eligible for. Depending on where you live, that will be either Harvard Pilgrim Quality HMO or Unicare Community Choice. These are our two remaining limited network plans. As I said in the prior slide, if you are default enrolled into one of these plans, please be aware that your premium could be higher than it is today. So again, it's important to check your options this year. In addition to the two limited network plans, you can also choose from a variety of broad network plans offered by Unicare, Harvard Pilgrim, and Mass General Brigham Health Plan. Moving on to Harvard Pilgrim, both their broad and limited network plans will continue to be offered as they are today, though they will have new names. The Independence Broad Network Plan will now be called Harvard Pilgrim Explorer, and Primary Choice, today's limited network plan, will be called Harvard Pilgrim Quality HMO. So other than the change in names, there's not a lot of change here. And for those of you who are in these plans and want to stay in them with their new names, the good news is that your premiums will not be changing much. Moving on to Unicare, the Unicare Basic Indemnity Plan, Unicare Basic that we offer today is essentially being replaced by two separate plans, depending on where you live. First, if you live outside of New England, a new plan called Harvard Pilgrim Access America will be your new plan. For those who live in any of the 6 New England states, Unicare Total Choice will continue and will be very similar to today's basic plan. As you know, you do have other choices in the broad network category. I'll say a little bit more about each of these two new plans in the next 2 slides. So for many years, GIC members who live outside of New England have been covered by Unicare Basic, which has been our most expensive plan. As a result of our recontracting process, we are now pleased to provide a less expensive plan through Harvard Pilgrim called Access America. This new plan will offer broad access to hospitals and doctors as Unicare Basic does today, and there will be no changes to co-payments, deductibles, or the out-of-pocket maximum. It is a nearly identical plan to Basic, but with a lower premium. Also, for those who have been enrolled in Unicare Basic, you know that for many years, that plan has included an optional component called CIC, which stands for Comprehensive Insurance Coverage. You also know that you have had to pay 100% of that added cost on top of your premium. Until now, the state has not covered a percentage of that extra cost. As of July 1st, however, we are folding this member pay all cost into the plan's regular premium. So what this means is that the state will now pick up its share of that additional cost. Your coverage will be the same as it has been under Unicare Basic with CIC, but the cost and coverage will now all be incorporated into the plan and its premium. This is all somewhat complicated, particularly for those of you who are not familiar with this plan, but in a nutshell, you're getting the same great coverage, but you don't have to pay that extra CIC cost by yourself. One important note here is that eligibility for this national plan is determined by the address that we have on file for you at the GIC. So please make sure that the address that we have is up to date. And I'd say the member portal, MyGICLink, is a great way to do that. As I mentioned, for those of you who reside in New England, Unicare Basic will now be Unicare Total Choice. It will continue to have the same broad choice of doctors and hospitals, and we are making a few positive changes to that plan to make it easier and simpler to use. Again, as I noted, with the new national plan, we are removing the member pay all portion of the premium for this Unicare plan, the CIC portion, and folding it into the plan's premium, and the state will be picking up its share. Also, for this plan specifically, we are doing away with tiered copayments and replacing them with flat copayment levels. I'll say more about this in a few moments. The next change is to Always Health Partners. First, as I mentioned earlier, they have changed their name to Mass General Brigham Health Plan. This is not a change that the GIC is making, but rather one that this insurance company has decided to make for themselves. And here I just want to make sure you understand something important. Just because this health plan has Mass General Brigham in its name, it is not the only plan that gives you access to Mass General Hospital or Brigham and Women's Hospital. You can still enroll in our other broad network plans and have access to those hospitals and their affiliated doctors. Second change is that in the past, this plan has not been available to residents of some communities in Western Mass, but we are now able to offer this to any resident of Massachusetts, no matter where you live. Finally, since this is now a statewide plan, it will have the same copayments and deductibles as other plans in the broad network category. This will mean some higher copayments and a higher deductible. So if you are in this plan today, it's important to evaluate whether it will still meet your needs, or if you may prefer something else with a lower cost share, like one of our tour limited network plans. Finally, Unicare Total Choice, which again is the plan to replace Unicare Basic for those who reside in New England, and Unicare Community Choice will largely continue unchanged. But I do want to note that we are making a few changes to copayments for a subset of services in all of our Unicare plans. So first, for all Unicare plans, we've added copayments for eye and gastrointestinal procedures when you get them at a freestanding facility, as well as for outpatient services. And second, and this is specific to Unicare Plus and Community Choice, we've made a small change to copayments for non-preventative visits to primary care providers. So in the prior slides, I've touched on changes to cost sharing across our plans. I thought it would be helpful to pull them together all into one slide here. Again, all of these details are described in the benefit guides that are posted on our website, and I encourage you to review all of those. And again, this slide deck will be available on our website. Before we get to premium rates for these plans, I want to share this table again, which will also be available in our benefit guide for your study. This shows each plan that we offer today and who is eligible for each plan. It also shows on the far right the plan that you will be enrolled into by the GIC if you do not actively choose your own plan. So when you review your benefit guides, encourage you to pay close attention to this table. So now to round up the health plan changes, we will say a few words about how premiums are changing. So there's a lot on this slide, and I apologize we had to use such small font to fit it all on here. But again, don't worry, if you want to spend time studying this slide or any other slides, you can find the deck on our website. Here we show full cost premiums for each of our plans and how they're changing. So I want to be clear, the premiums shown here are not the amount that you will pay. That's the next slide. This slide shows the total cost of the plan, which combines what the state pays and what you pay. What I'd like to draw your attention to is the fact that while a few premiums are increasing more than 9%, most are increasing by much less, and some of our plan premiums are actually decreasing. So again, that's one more reason to make sure that you do your homework during annual enrollment this year, review your benefit decision guide, and make the choice that's best for you. And finally, on the health insurance plans, this shows what you will actually pay for each plan that we're offering based on your date of hire. As I mentioned before, this table will also be included in the benefit guide, and this table available on our website. And so the rates shown here are the monthly contributions that you will pay. These are the amounts deducted every month from your paycheck. So if you want to know how much you'll be paying each pay period, you may have to do some additional math. For example, many employees in the executive branch receive paychecks bi-weekly. So you could divide these rates by 2 to know how much comes out of your paycheck, but not all of our members are paid bi-weekly. So do the extra math based on what the monthly rates are that we show. I do want to note, if you are a municipal employee, the contributions are somewhat different, as you know, so you'll need to reach out to your city or town benefits lead to find out what your rates are. So this is just a reminder that you may submit questions anytime during the presentation using the Q&A tab of Zoom. We will review your questions real time and respond to as many as we can. And when we finish, we'll verbally address some questions that we hear that we think everyone will be interested in. And again, if you have a question that's specific to your coverage, including personal details, please don't use the Q&A, but get in touch with us directly as we note on the screen. Now I'd like to turn to a change in how we provide your prescription drug benefits for those of you enrolled in active employee plans. So CVS Caremark will replace Express Scripts as the company that will provide your prescription drug benefits. So starting on July 1st, you'll need to use a new CVS Caremark card when filling your prescriptions. When it comes to your prescription drug benefits, there is nothing you need to do during annual enrollment. Your coverage will automatically be switched over to Express Scripts, and CVS Caremark will be sending you a welcome packet, including all that you need to consider as part of this transition, and you will receive your new insurance card. However, there are a few important suggestions that we want to make so that this can work smoothly for you. So number one, if you have a recurring prescription, you should take your new CVS card to your pharmacy and make sure that they have your new information. If you or a member of your family are taking long-term medications such as for high cholesterol, you will receive a letter from CVS Caremark asking how you would like to receive future refills, whether by mail order, delivered to your home, or picking them up at your local pharmacy. For those medications, you have some choices. If you have questions about your specific prescriptions or coverage, as soon as you get your CVS Caremark card, you can call them directly at the phone number located on the ID card. I do want to make one point here, a question that we've gotten in previous sessions. Though they're part of the same company, just because your ID card will be with CVS Caremark, this does not mean that you can only use CVS retail pharmacies. CVS Caremark will manage your prescription drug benefits, but you will still have access to a broad range of retail pharmacies beyond just CVS, including Walmart, Walgreens, and others. So now I'll move over to a change in our flexible spending accounts for the coming fiscal year. So bear with me while I say a few words about flexible spending accounts, commonly referred to as FSAs. An FSA allows you to set aside money pre-tax from your paycheck throughout the year and use that money to pay for qualifying medical expenses or childcare expenses. It's a great way to plan for these expenses and actually save some money because it's a pre-tax contribution. Currently, our FSA programs are administered by Benefit Strategies, but beginning on July 1st, this will change to a new company called Total Administrative Services Corporation, also known as TASC. And so let me just say a word about each of our programs. For healthcare expenses, you can use a healthcare FSA, and this you can use to pay for items that your health insurance plan does not cover. So co-pays, deductibles, as well as dental visits and vision expenses like new glasses. For the healthcare FSA, you can put aside a minimum of $250 up to a maximum of $3,050. Similarly, for dependent care expenses, our dependent care FSA offers you the chance to pay for eligible childcare costs or expenses related to caring for a disabled adult dependent. And the IRS allows you to set aside a minimum of $250 up to a maximum of $5,000. It is important to note that in exchange for the tax savings that come with these plans, the IRS has a use it or lose it rule on these funds. So you'll want to make sure that you use the funds by the end of the plan year so that you don't lose additional funds. There will be, however, a grace period that will, for FY23 plan year, that will run to September 15th, 2023. And then you'll have an additional 30 days to October 15th to file claims to use those funds. So if you're interested in enrolling in either of the FSAs, it's important to know how the details work. So again, please review your benefit guide to learn more. So with our new administrator for the FSA, you'll be able to use several different channels here to enroll in and manage your FSA. And these websites will be up and running as soon as annual enrollment starts next Wednesday. So if you plan to have an FSA for the coming year, there are a few things you need to know about this transition. If you're not enrolled in one and are not planning to, you could probably tune me out for the next few minutes. But for those of you who are or will be enrolled, there's a few details that are unique this year that we want you to be aware of. As I mentioned, there is a grace period for FSA funds for the current year. This grace period will be administered by the new vendor of TASK. So TASK and Benefit Strategies are working closely to make sure that all the funds that you have are transferred over to TASK. And that will happen on June 30th. In order to do this transfer, there will be a brief blackout period from June 30th till approximately July 18th. Again, this only applies to FY23 funds during the grace period. It will not impact funds for the coming fiscal 24 plan year. So if you're enrolling in the FSA during annual enrollment for the coming year, those funds will be available with your new task card starting on July 1st. If you plan on using FY23 funds during the grace period, you can still incur expenses during the blackout period. You just need to make sure you pay those bills, maintain a record of them, and submit a claim to TASK. So June 30th is the last day you can use your Benefit Strategies card. And if you're enrolled in fiscal 23, you will receive a new card in the mail from TASK before July 1st. Lastly, I just want to note that if you're enrolled in the commuter or parking benefits through Benefit Strategies, you will continue to use your Benefit Strategies card for that. That program is not run by the GIC, rather by the Comptroller's Office, and it is not impacted by any of these changes. They will continue to work with Benefit Strategies. So next, I will move on to say a few brief words about dental and vision benefits for fiscal year 24. Very brief. Dental and vision benefits will continue to be available to members who are not covered through your unions or those who do not have another dental or vision plan through the Commonwealth. There are no changes to these plans. However, you will want to review the rates in the benefit guide as they are increasing slightly. And finally, just a quick word about our employee assistance plan. So Mass for You is the employee assistance plan that the GIC offers, and it's managed by a company called Optum. This program is available to all employees who are eligible for GIC benefits. You do not have to be enrolled in a GIC health plan to access these benefits. And they offer a comprehensive list of free confidential supports, including virtual therapy visits, in addition to what your health plan offers, consultation on legal matters and mediation, assistance with financial issues if you're trying to manage your debt or you're facing a foreclosure on your home, and a variety of other services. So I really encourage you to take a visit to the GIC website, learn more about this program, and find out how you can take advantage of it. One last reminder as we come to the close of the presentation that you may submit questions at any time during the presentation. So it's the final section. As I've said several times already, it's important to be engaged this year regarding your insurance benefits. So as we come to a close, I want to just say a few words about how you can prepare for the annual enrollment. So here we provide a brief checklist on key steps you can take. Number one, plan ahead to make sure that you can get us your changes before May 3rd when the annual enrollment period ends. Second, check with the insurance companies if you're considering enrolling in one of their plans. You'll want to make sure that the doctors and hospitals that you want are included in their network. They will have provider directories, which will include these lists of hospitals and doctors. Please know that these will be available once annual enrollment starts on April 5th. So still a couple of days before you can look that stuff up. But know that that is there and an important resource for you. Contact your doctor to make sure that they accept an insurance plan that you may be considering. And finally, if you're turning 65 soon, and this is irrespective of annual enrollment, visit the GIC's benefits website because there's a wealth of information there about steps that you need to take. Finally, while you're deciding on which plan is best for you, it's important to consider a number of factors. Where you live is really important because it determines what plans you're eligible for. What type of coverage works for you best? Is it broad access to providers that's most important, or is the premium cost that comes from your paycheck most important because you have other options aside from those broad network plans? Networks, I've already touched on this, are the doctors and hospitals you want in the network. If they are, what tier are they in? Because you'll have a higher or lower copay depending on that tier. And finally, budget. How much are you willing and able to pay for your insurance? We offer plans with broad access to hospitals, but they come with higher copays and higher premiums. But we also offer plans that exclude the most expensive hospitals and doctors. And in return, you get lower copays, a lower deductible, and lower premium. So it's really important to decide which is the right combination for you. So we'll close with this slide for your reference that has phone numbers and websites for all of the companies that the GIC will be working with, along with some other useful resources. Again, no need to rush to scribble this stuff down. It will be in your benefit guide and available on the GIC's website. So before we move to question and answers, I want to thank you for attending the session. Please be aware that there is a lot more information coming your way beyond this session. Your current health plan will likely be reaching out to you with information you'll want to review. As I mentioned, our benefit guides are now on our website and loaded with details about annual enrollment. They really should be your go-to source for information. And as always, you can check out our website for a variety of other resources. Again, that's mass.gov/GIC. So with that, we will now conclude the presentation and verbally address some of the questions that we've been receiving in writing. And for that, I will turn it over to the GIC's Chief of Staff, Emily Williams. Emily?
Hi, thanks, Matt. So as Matt mentioned, we encourage you to continue asking questions using the Q&A chat function of Zoom rather than raising your hand. The Q&A function, and during this, you can continue asking questions, and we do have staff who are answering the questions as quickly as they can. And I will also pull out the questions that are most frequently asked and apply broadly to the most members watching this webinar. So at first, Matt just addressed some of this, but I see a lot of questions about materials, when they will be available. And I want to direct you to the chat where Mike Berry from our staff has been uh, putting a lot of links, a lot of helpful resources. And this includes the link to the benefit guides, which are available online. Active members will not be receiving benefit guides in the mail. So the uh, mass.gov/GIC website is the best place to find your benefit guides. He has also provided links to our YouTube channel where you will be able to find recordings of this session after it has been completed. And if you have colleagues who have reached out to you that they unfortunately were not able to join our session today due to the capacity limits, they can go there now and find recordings from our previous sessions where we gave the same presentation and answered a lot of the frequently asked questions. And they can also find the presentation online on our website, the deck that was used for this presentation. It's a great resource to look over as you review your benefit guides for additional information. And there's, again, a whole other host of information there. And once these are complete, we'll also be compiling a frequently asked questions document that you can view at your own leisure. So to get into the questions, I think the first question that we're receiving a lot of that perhaps Paul from our operations department can address is, how can I sign up for MyGICLink, and what should I do if I don't know my PIN?
Sure. On our website, Emily, we have a MyGICLink page. It gives you a video and also has instructions on how to register for MyGICLink. If you are having difficulty still after you read the presentation or try to register, we recommend that you reach out to GIC directly. You can call our main number at 617-727-2310, and you can ask to speak to a member in our public information unit, or you can go directly online on our website and you can fill out an online request form in which we can contact you directly with instructions on how to fill it out. So there's two ways. You can do it through our website, or you can call our office directly if you're still having difficulty.
Wonderful. Thank you, Paul. And see, Matt, we have a question about coverage for dependents. If the enrollee lives in New England, but their dependent lives outside of New England, what options are available to them?
Yeah, I could probably answer that, but I think I'll ask Paul Murphy to answer that question. He'll do it better than I can.
Sure. What I could try to do is, let me see if I can break it down by plans to give you a little guidance on how it works. If you live outside of the 5 New England states, and I say you reside outside, the only plan available is Harvard Pilgrim Access America. So if you have to go into that plan because you reside outside of New England, your dependents will be covered anywhere in the United States in that plan. So Harvard Pilgrim Access America outside New England, your dependents are covered anywhere in the nation. If you live within the New England area, there are several plans available to you. There's the Unicare Plus plan, the new Harvard Pilgrim Explorer plan, and the Unicare Total Choice plan. Those plans have a wider network. So if you live within New England and you are enrolled in one of those plans, dependents will still have coverage outside of New England, regardless of where they live. So that's the Plus plan, Unicare Total Choice, and Harvard Pilgrim Explorer. For some of the other plans that are within Massachusetts, the Mass General Brigham, Health New England, and Harvard Pilgrim Explorer, we would always recommend to contact the plan directly for questions regarding out-of-area network coverage for dependents who live out of state. So Access America, no problem, coverage is there. For Plus, Harvard Pilgrim Explorer, and Total Choice, they do have a network that covers dependents if the dependents live out of New England. And Mass General Brigham, Health New England, and Harvard Pilgrim Explorer, it's always best to call the plan to get the details on the out-of-network coverage for dependents.
Thank you, Paul.
Thank you. And I did want to address just one housekeeping item, which I think Mike has also addressed in the chat. For using the Q&A function, if you have a follow-up question to a question that you have already asked, if you could try to include the whole question again, or refrain from asking one-off follow-up questions. It's difficult to keep track of who they belong to, so we may not know what you're asking about if there's not additional context provided. And I did also want to clarify, I know Matt encouraged that you look to the plans for coverage and network information. And again, that information will be available once annual enrollment begins April 5th. So we encourage you to do that during annual enrollment. Some of the websites have not yet been made live. All right. And Matt, we have a lot of questions asking if you can explain the different types of coverage in a little more detail. The POS and that type.
Yeah, this can be very confusing terminology. So I'll give this another try, and it may sound a little repetitive to what I said earlier. So we have health maintenance organizations, HMOs. That is a closed network of hospitals and doctors. So in order to get care covered by that plan, you can only see a doctor or hospital that is included in that plan's contracted network. So you'll want to make sure that you check the provider directory for the specific plan, which you'll be able to find on that plan's website starting next Wednesday. An HMO also requires you to have a designated primary care physician, and that PCP will kind of manage your care, be the kind of central source of guidance for referrals for different services that are covered by your plan. A POS plan is a point of service plan, which sort of has the same kind of network of providers and hospitals, and you have a lower copay when you see a provider in that network, but you also have access outside of the network for a somewhat higher copayment. So the real difference is how broad your choice is for a doctor or hospital that you want to see. So POS plans tend to have a slightly higher premium for that additional choice. An indemnity plan really allows you to see just about any doctor or hospital. It is the GIC has long had an indemnity plan that's been handled by Unicare, several of them actually that are based on an indemnity structure. So you don't have the same sort of network type features in an indemnity plan. So if you're looking for the widest choice of providers, an indemnity plan is probably the best one for you. And then similarly, the broad network plans, so the point of service plans, as I said, offer the widest choice. We do also offer two plans that are limited network plans. So they're the same as an HMO. They are very similar to an HMO in that they have a defined network, but they tend to exclude the most expensive hospitals and doctors. In exchange for that, you have lower copayments and lower deductible and a lower premium. So they're all slightly different, and it really depends on which feature is most important to you. Is it broad access? Is it a lower premium? It's part of the decision that you'll have to make is determining what's most important to you. I hope that's helpful.
Thank you. And I again want to remind members that please refrain from asking personal questions or sharing personal information in the Q&A. We will not be able to answer those questions during this session out of protection for your privacy, and we encourage you to use the contact methods that Mike Berry shared in the chat function. Matt, we have a number of members asking if you could talk about CIC again and clarify.
Yeah, that's also another complicated feature of our plans, which you don't see in most health insurance plans. So in order to make sure that that indemnity plan had broad coverage of all the services and care that you will need, we've had to have this additional program on top of it called the CIC. And the way it's been structured in the past is that the member pays the entire cost of that additional CIC coverage. What we have decided to do is to make that much more like all the other rest of the plans. So the CIC will essentially be incorporated into the plan and its premium. So all the coverage that you get with the CIC will be included in the new plan. The cost of that CIC will no longer be a separate thing that you have to pay the whole amount for, but it will be incorporated into your premium. So if based on your date of hire, you're covered, the state pays 75% of your premium, they're now going to be paying 75% of that additional cost. So we're really shifting some of it off of our members to make it much more like the rest of our plans. So you really won't see the CIC as kind of a separate option anymore in our new plans for the coming fiscal year. I hope that's helpful.
Thank you. And we have a number of questions asking if you live outside of New England, are you required to enroll in Harvard Pilgrim Access America?
Yes, if you live outside of the New England states, if the residents that we have on file for you, outside of New England, if the residents that we have on file for you is outside of the 6 New England states, then Access America is the plan for you. So that's Maine, Vermont, New Hampshire, Massachusetts, Connecticut, Rhode Island. So
Matt,
again, go ahead.
Can I add something? I've been trying to answer a lot of questions, and a lot of the questions we get about outside of New England are not for the employees who have the coverage, it's for dependent family members. So if you're worried about covering a member of your family who lives outside of New England, you have plenty of options available as a New England resident. You can choose from either the Unicare Total Choice, formerly known as Basic, or the Plus plan, or the Harvard Pilgrim Explorer plan also has access to the same network of providers across the country as the Access America plan. The reason we have 2 separate plans is the contractual rates that we pay providers within New England are better and more advantageous for the state and therefore our membership under the POS contract, which is why we kept the framework for Explorer that we used with Navigator and Independence. Hopefully that clarifies matters a little bit better when we're talking about out-of-state residents.
Thanks, Cameron.
Okay.
Thank you. And following on that, we have another of members asking if emergency services are covered on all of the plans when you are traveling.
I believe the answer to that is yes. Cameron or Paul can confirm that.
Yes, that is correct, Matt.
Thank you. And switching to pharmacy, we have questions asking for clarification if members can continue using a non-CVS pharmacy for 30-day prescriptions, monthly prescriptions.
I believe the answer is yes, but if there's a nuance to that, Janine Dewar, you want to add?
Answer is yes for 30-day.
Thank you.
Thank you. And staying on pharmacy, are there any changes to the specialty pharmacy?
There are changes to the specialty pharmacy under Express Scripts. It's been Accredo, but CVS Caremark will have its own specialty pharmacy.
Thank you. And where will members be able to learn what tiers the hospitals fall into?
So that you will be able to see in the health insurance company's provider directories starting next Wednesday. You'll be able to see all of that.
There's also, if you're concerned with hospitals alone, there's also a chart that is posted on the GIC's webpage that shows the tier for every hospital facility in the state of Massachusetts for each of our medical plans.
Thank you. And if a member's, after evaluating all of their option, if a member decides that they would like to go into a default plan for their coverage and their plan is ending, will they need to take any action to enroll in the listed default plan?
Yeah, that's a great question. The answer is no, you will not have to take any action. If you review the plan that we will put you in, if your plan is being changed substantially or going away, we will handle that for you and you don't have to do anything additional.
Thank you. And I see a number of questions asking, though annual enrollment begins next week. This is for benefits for the plan year beginning July 1st. So this is for coverage beginning July 1st. And this applies to all of the plans. This includes FSA, dental vision, as well as health. And this may be a good question for Cameron. Can someone please talk more about what types of expenses you can use your FSA account for?
Sure. And I always like to take the opportunity to delineate and explain again the difference between the two types, excuse me, of FSA plans that we have available. There is the healthcare savings account, or the HCSA, which is the medical care FSA. Now, you can use that plan to pay for any qualifying medical expenses for you or your family members. Anybody who could conceivably be claimed as a dependent on your tax return is eligible for, you can use that account to pay for their medical care. That can be office visit copays. It can be copays or expenses towards your deductibles. It can be prescriptions. Recently, they've opened up a large number of over-the-counter items, such as antihistamines, pain relievers, basic first aid supplies, PPE as a result of the COVID emergency. There is a shop available and lots of information on both FSA providers' websites. Both Benefit Strategies and Task have links to exhaustive lists of what those qualifying expenses or items that you can use the medical FSA for. Now, the dependent care FSA. Now, we have a lot of confusion every year. We have, an indeterminate number of folks who enroll in the dependent care account, thinking that's what they have to do in order to pay for their family members' medical expenses. That is not what that plan is for. The Dependent Care Assistance Plan, the DCAP, That is it's intended for childcare that allows you to go to work. So if you say are injured and are off work for a couple of months and receiving the new paid family and medical leave benefits, you are not working, so you cannot use the dependent care account for expenses during that time. So again, the dependent care account, that is for childcare while you are at work. Now that does include day camps in the summer for children, and it can also be used if you have adult dependents who cannot care for themselves. It can also be used for those expenses as well. And in explaining all that, did I lose track of the original question, Emily? Could you please refresh my memory?
No, I don't think so. I was just looking for more information on how
Okay.
these funds could be used.
Yeah.
Although you could clarify for me while you have the mic, if are members able to enroll in dependent care FSA account after having a child? Is that a qualifying event for enrolling in an FSA account outside of annual enrollment?
That is absolutely a qualifying event. For the medical FSAs, the qualifying events are basically the same as any other GIC benefit. So if you get married, divorced, have a child, a family member passes away, a change in the composition of your family, a change in your employment status. There are additional qualifying events specific to the dependent care. So if you change daycare providers, your expenses could go up or down as a result. You may want to adjust your withholding as a result. If one spouse stops working or goes back to work and assumes or gives up childcare responsibilities at the home, that's also a qualifying event. So there's a little more latitude when it comes to the qualifying events because for the dependent care, just because childcare itself can be, a fluctuating expense throughout the year.
Thank you. And keeping it with you a little longer, Cameron, can you clarify people are able to enroll in both types of FSA accounts at the same time?
Yes, you can absolutely participate in both. You can max out both plans' annual deductions, which is just over $3,000 on the medical FSA side and $5,000 per household on the dependent care account. Those are use it or lose it plans, and we do have the grace period. Matt's mentioned the fact that TASC will be administering the grace period, the fiscal 23 run out. And while we have to allow Benefit Strategies, the current administrator, a chance to close out and reconcile the fiscal 23 records and then transmit that information to TASC, who then loads it up into their system, which is why we will have that blackout period. During that blackout period, you can pay for expenses out of pocket, then submit the receipts to TASC for reimbursement out of your fiscal 23 funds. You can also use your new TASC card and use your fiscal 24 funds, which on the healthcare side are available day one. Your entire year's election on the healthcare FSA is available at the start of the plan year. So you could use your fiscal 24 funds during the blackout period. Then once that blackout period ends, TASC has agreed to go back and retroactively apply, where possible, any claims that are paid during that blackout period against fiscal 23 funds where it's allowable. And there is only one administrative fee you pay. It's $1 per month per member, regardless of whether you're in one plan or both.
Wonderful. Thank you, Cameron, for giving all those clarifications around FSA. And if I can, I think have another question for Paul here. Paul, can you talk a bit about qualifying events and where members can find information about qualifying events and maybe high level what some of the major qualifying events are that would allow members to make changes to their benefits outside of annual enrollment.
Sure. The qualifying events that GIC in which you can make changes to your health plan on our website, mass.gov/GIC, you can find a chart, qualifying event chart, and this will give you all of the qualifying events that allow you to make a coverage change. So high level, birth of a child, marriage, divorce, death of a spouse, allow you to make changes to your health insurance plan or enroll with GIC benefits off the annual enrollment cycle. So if the annual enrollment has already taken place and you get married, have a child, get divorced, or death of a spouse after annual enrollment ends, you can make changes or enroll in your GIC benefits. I would recommend that you take a look at the qualifying event chart to see if that event is listed. One thing to keep in mind, there is a 60-day window to make changes from that event. So if you do not make a change or enroll within 60 days of that event, then you have to wait until the next annual enrollment period to make any changes. Now, what we mean by changes are if you need to change from family to individual, individual to family, or enroll for the first time. It does not allow you to change health plans. So those events keep you in the plan or enroll you in a plan, but it doesn't allow you to make a health plan change from one plan to another. The only time we allow a health plan change is if a member moves out of the health plan service area. At that point, the member can select a new health plan, but that is the only condition in which we allow members to change from one plan to another off the annual enrollment cycle.
Thank you, Paul. And I think the next question is also a good one for you, Paul. If a member is not currently enrolled in GIC but would like to get started during annual enrollment, what steps should they take?
The member can enroll during annual enrollment, April 5th to May 3rd, for coverage effective July 1st. There's a couple ways. If the member has no benefits with GIC right now, you can visit the HR office. There's a GIC coordinator at your agency who can give you the paperwork to enroll in GIC benefits for annual enrollment. Just keep in mind that if you're adding dependents or a spouse, we will require birth and marriage certificates to enroll family members. But the GIC coordinator at your work site can help you enroll. You can also download the application on our website. It's print forms. It's what it's referred to on the website, in which you can enroll and download the forms and send them into GIC. And we also have the MyGICLink system through DocuSign, in which you can type in your information and request forms be sent to you electronically. You can fill them out and send them back to GIC electronically. So you can download the paper, see your HR office, or go to the MyGICLink and fill out the forms to have them sent to you electronically.
Thank you, Paul. And Matt, I think if we can go back to you, we have had a number of questions asking if the GIC offers an individual +1 plan.
We do not offer an individual +1 plan. We get this question quite often. We have evaluated that in the past and will continue to do so going forward to see if it can provide an additional option to our members without significant disruption to others of our members. But at this time, based on our analysis, we are not adding an individual +1.
Thank you. And I'm seeing a few people ask questions who were able to join after some other participants left today due to the maximum capacity. And I do want to, again, remind members that a recording of this session will be available on the GIC's YouTube channel following this after the session is complete. The presentation can already be found there, the presentation deck, as well as we will be sharing some FAQs. So I apologize if you were not able to join at the beginning of the session, but we will have all of these resources available for you to look over at your own convenience. And can we clarify again on FSA if the change in administrator will affect the transportation benefits?
No, the transportation benefits will remain with benefit strategies. That is contracted separately through the comptroller's office.
Thank you. And I think if we can go back to Paul, would you be able to give a high level on what individuals should do, where they can find resources if they will be turning 65 this year?
Sure. On our website, there is a video for members turning age 65. And it gives you instructions on what you need to do. If you are retired, GIC will contact you or your spouse directly at home and give you instructions on what to do when you turn age 65 and you are retired. If you are age 65 and continue working for the Commonwealth, you do not have to enroll in Medicare. You only do the Medicare enrollment when you retire. So we get a lot of questions for people that are turning 65 or covering a spouse who's turning 65, but they want to continue working for the Commonwealth after 65. In that case, they just stay in the plan that they have, and they do not have to enroll in Medicare until they retire.
Thank you, Paul. And can you also talk a bit about what members should do? It's not entirely clear to me, so this may be a two-part question. If a member has a dependent, I believe, who is turning 26, and is on their coverage, so their coverage will stop at 26,
Sure.
what action they should take. And then I think another way of the question is if the member themselves is turning 26 and looking to join GIC.
Sure. We'll take the one where the dependent. If you have a dependent covered under your health plan today, and that dependent can stay covered under your health plan until age 26. Coverage ends the end of the month in which the dependent turns age 26. So they get coverage through the entire birthday month in which they turn 26. At that point, the dependent is eligible for COBRA through the GIC. GIC will send a notice out to the member stating that the dependent's coverage is ending. But if you also want to go on our website, we also have information on how you can enroll the dependent in COBRA, starting the first of the month after the coverage ends at age 26. If you are a member covered under a family member's health plan and you are also a state employee eligible for benefits, turning age 26 and loss of coverage under your parent's plan is a qualifying event for you to come into GIC benefits, not during annual enrollment, but anytime throughout the year. So if you're losing benefits as a dependent covered under another person's insurance through private employment, then you can come into GIC's benefits throughout the year. That is an event because you are losing coverage under your parent's plan.
Thank you, Paul. Going back to pharmacy, I see some questions asking if we could clarify what the process will be for maintenance medications. So medications that are longer than 30 days, what actions members will need to take or can expect from CVS.
I can take this one. So members should either go to a CVS retail pharmacy for 90-day supplies of medication or have them filled through CVS mail. And there will be more information coming from CVS to that effect.
Thank you, Janine. So just to clarify, members will receive outreach from CVS as well.
Yes.
Thank you. And as we're nearing the end of the session, I'm giving our staff, there's still a number of open questions. I want to give the staff time to answer questions in the Q&A function. Again, the recording of the session will be available as soon as we are able to post it after this session is complete. You can already find the recording from previous sessions, including there were 2 sessions specifically for retirees that were held earlier this month. And you can find those on our GIC YouTube channel. There's a link to it in the chat of this Zoom, but you can also find all of these resources at any time by going to mass.gov/GIC. And I still see questions about when plans will have their websites available with more information about networks and coverage. And I suggest that you look at that during annual enrollment. They will have them by April 5th, which is the start of annual enrollment.
Emily, I'm also seeing a lot of questions about whether a PCP is required for the different health plans. And I'd just like to mention that in the benefit decision guides, all of the benefit decision guides, there is a section called Benefits at a Glance, in which it lists all of the health plans and the type of plan. There is a line for each plan, and it answers whether or not a PCP is required for that plan. So that should help a lot of people with a lot of questions I see in the chat about is a PCP, which plans require it, which ones don't. The Benefit at a Glance pages in all of the books tell you whether you need a PCP or not for that plan.
Thank you, Paul, and thank you for highlighting that great resource. And while you have the mic, Paul, if you could clarify once again the process that members should take if they are having trouble accessing MyGICLink and getting a PIN.
Sure. If you want to go back, Leslie, to the contact page, I would recommend where it gives the phone number. Okay, if you were having difficulty accessing the MyGICLink member benefits portal, you can call our office directly, 617-727-2310, and you can speak to a representative in our public information unit. You can also go to our website, as Emily said, mass.gov/GIC, and you can complete a GIC online contact form. You can fill out that form, give us your phone number, best time to call you, and we can reach out to you to help you register for the portal.
Thank you, Paul. And if you could give some information quickly about, or high level, sorry, about where there are some different qualifications for some of the GIC benefits, such as for dental or FSA. I know that some members may get those through their union or through their town. Could you give a little high-level overview of that?
Sure. For state employees, we offer life, health, long-term disability, and a dental vision plan, but the dental vision plan that GIC offers is only available to managers of the Commonwealth or those members that are not covered by collective bargaining. Most people that are covered by collective bargaining get their dental and vision benefits through the union. That is not administered through the GIC. We only do people who do not get collective bargaining benefits. Also, our dental vision plan is not available to members of authorities, higher education. Those people are not eligible for GIC's dental vision benefits. Municipalities, they only get GIC health insurance. We do not offer any other benefits to members of our municipalities, and their dental and vision benefits are administered directly through the municipality. So it is complex on the different benefits that we offer, but high-level municipal employees only get health insurance through the GIC. State employees get life, health, long-term disability, and some dental if they're not covered by collective bargaining. But a lot of confusion with the collective bargaining is we don't administer that plan. If you're covered by a union, you have to reach out directly to your union to find out about those benefits.
Thank you, Paul. And while we are at time, I'm just giving our staff a minute to answer some of the outstanding questions. And I do want to remind members that if you have a question that is very unique to your specific situation, and we weren't able to answer it today due to sharing personal information, there is an online contact form and phone number that was shared in the chat. And that's the best way to reach the GIC. All right. We really appreciate all of the questions that people have asked today. And our staff is still busy trying to get to as many of them as possible. And I again want to remind everyone that all of the information is available on mass.gov/GIC. Mike just shared in the chat the slide presentation that was used today's. And if you follow that link, you will also be able to find a different presentation, which was used for retirees if you are thinking about retiring or if you joined the session but are a retiree. This session was geared specifically towards active members. So again, if you're a retiree, you can find the recording on our YouTube channel and you can find that presentation deck on our website. And again, Mike has shared a number of helpful resources in the chat, the hospital tiering list, where you can find what tiers different hospitals may fall into, the GIC contact form, information if you're turning 65, and for our YouTube channel. And I recognize it's a lot of links. So again, just mass.gov/GIC is where you can find all of this. And after today's session concludes, that's the best source of any information if you are looking for any of these resources. And as we're nearing the end of the session, I'm just going to give our staff a moment to answer a couple more questions, and then I'd like to hand it back to Matt.
Thank you, Emily. While staff continue to do that, I see that we've answered nearly 350 questions in writing throughout the session. And if by the end of this, in just a moment, you have not had your question answered, please feel free to reach out to us directly. Again, on this slide, you'll see the phone number and the online contact form. Our staff are terrific at answering any question that you may have or pointing you in the right direction. I do want to thank everyone for participating. We've had a tremendous level of interest in the sessions that we've held. The recordings, again, will be posted on the website, as Emily has noted. All the questions that we receive and respond to, we are also posting those as an FAQ, frequently asked questions document on our website. So all of the information that you've heard and that's been asked and answered here, you can find one way or another on our website. And again, the slides that we've used here, you'll see. I just want to point you back to your benefit decision guides as well. Here, we've used this as an opportunity to give you a bit of a preview, but all the details that you really need to know will be found in the benefit decision guides and by contacting the health insurance companies, looking up on their provider directories. But any way that we can be helpful to you, please let us know. We're here to serve you and to help you. It's, as I've noted throughout the presentation, we've got a good deal of change here this year, and we want to make sure that we're here for you to help you make the right decisions. So thank you for making the time. Really appreciate your attention, and please contact us if we can help you. So thank you. Have a wonderful Friday and a wonderful weekend. Thank you so much.